Hello everyone, welcome to Dr. PK Live channel on YouTube. So in this video, I'm going to talk about various screening modalities available for colon cancer screening. Of course, colonoscopy, as you know, is a gold standard. It's a flexible camera um, which does examination while you're sleeping of the entire colon. Frequency every 10 years if normal. Pros, it detects and removes polyps in one procedure. It's most sensitive and a specific test. It's invasive though. It requires bowel preparation. Lots of people hate them and you have to go through sedation. But nobody remembers what happened after sedation though. I had it done several years ago and I don't remember anything. A small risk is bleeding and perforation. Verdict, best overall test, diagnostic and therapeutic. Number 2, flexible sigmoidoscopy. Examines only the lower colon, rectum and sigmoid. Frequency every 5 years. Pros, is less invasive, no sedation needed. Many doctors do in their offices. Cons, is misses cancer and polyps in upper colon. Verdict, useful but less comprehensive than colonoscopy. Fecal immunochemical test, FIT. It's a stool test detecting hidden blood, occult blood, done every year. Simple, non-invasive, no preparation, better specificity than older stool test called guaiac test. Cannot detect polyp directly. If it is positive, that means you need colonoscopy as a follow-up. It's the best non-invasive option. It's very cheap. Fecal occult blood test. It detects hidden blood using chemical reaction done yearly. It's cheap, accessible, but it has a lot of false positive because of diet and medication, and less sensitive than fecal immunochemical test, FIT test. This test has been largely replaced by FIT test. Stool DNA test, Cologuard. It combines FIT with DNA markers for cancer. Frequency is every 3 years. Higher sensitivity than FIT test alone. But it has a higher false positive. It's expensive. I mean, almost as expensive as colonoscopy. And you still require colonoscopy if positive. And you have to do it every 3 years rather than every 10 years. Now, it's a good option if patient doesn't like to get colonoscopy done, and if colonoscopy is not feasible. They usually send you a big white box, and it takes about 15 minutes to collect a sample, and you send it back to them. That's it. Very simple and convenient. CT colonography, virtual colonoscopy. I'm sure you have seen in the TV and some TV shows and other YouTube channels. CT scan with bowel preparation creates 3D images. Every 5 years it's done. Requires full bowel preparation. Gives you radiation exposure. If it's positive, you still need colonoscopy. So colonoscopy is a daddy for everything. Everybody end up getting colonoscopy. So why not just get the colonoscopy? It's a decent alternative as well, but it's not a first line. Usually it's not available in lots of places. There's some experimental test called blood-based test called Septin9 investigational. There's a capsule colonoscopy. I'm sure you have seen in some talk show as well. Capsule colonoscopy, with the capsule is swallowed and it takes lots of pictures and thousands of images, and people who have access to the camera, they can see it remotely, and basically capsule has to be retrieved and brought to the doctor's office, and they also retrieve the images, and it gives them the picture of the whole journey of the colonic journey, and but it's not really widely adopted, and it's a very limited role, but it sounds really fantastic though. It's like a high-five, a high-tech kind of thing. So best to worst, colonoscopy is the best gold standard. FIT is the best non-invasive yearly, much cheaper. Cologuard stool DNA is good every 3 years, but expensive. CT colonography is useful alternative. Flexible sigmoidoscopy, it has partial coverage only, and it only, checks the colon, the lowest part of the colon, which is sigmoid colon and rectum. So that's about in detail about colon cancer screening. So thank you for watching. I really appreciate you guys.